right, ladies and gentlemen, thank you so much for being on the call today. Without further ado, I've already been introduced. My name is Niza. Today, I'm talking public health in the 21st century and some of the key takeaways that I want every person on this call to go away with is basically three things. The first being the evolution of public health in the modern era, how Texila American University is contributing to the public health education in the world, and then lastly, trends and opportunities in public health. So, what is the evolution of public health in the modern era? So we cannot begin to talk about the evolution of public health without understanding what public health is. So public health is the science and it is the art of preventing disease, prolonging life, and promoting health through organized efforts, as well as informed choices in collaboration with various sectors, okay, such as finance, education, agriculture, amongst others. So public health aims to prevent diseases in the entire population of the world, rather than focusing on an individual. So public health aims at promoting healthy lifestyles, encouraging healthy behaviors, amongst other things. So also, or not forgetting, promoting the access to healthcare for every individual. Now, according to World Health Organization 2007, public health in the 21st century is a dynamic field with unprecedented challenges as well as opportunities. Now, there has been on the rise a rapid growth of globalization, technological advancement, as well as increasing complexity in healthy determinants. So public health in the 21st century demands a comprehensive approach that is going to consider the complex interplay of the various factors that are influencing the health population today. So collaboration becomes precedent across the various sectors, okay, be it innovation and a strong commitment to the social justice if we're going to achieve, okay, global health for everybody. So some of the key areas of public health include epidemiology, which is basically the study of infectious diseases, biostatistics, mathematical models to analyze the prevalence of a disease or to predict the possibility of a disease and how to circumvent it looking at the numbers. Okay, then environmental health looks at discussing the environment in relation to the health of a human being and how the two are connected or interrelated. That includes community health as well. Then we have health education, which involves promoting public health education, be it from the community level to district level to provincial level, basically encouraging or promoting healthy lifestyles and behaviors amongst the individuals in a given population. Then coming up with the interventions and policies and managing those policies and interventions to achieve or prevent diseases in any given population. So, what are some of the challenges of public health today? Not in any particular order, but number one, we can look at global health security. For instance, the COVID-19 pandemic highlighted the need of interconnectedness of global health. So we saw various stakeholders, various sectors, both the private and the government coming together to fight the pandemic. That is one of the most recent realistic examples that I can bring to our mind today to remind us of how, global health interconnectedness can work. So we have emerging infectious diseases. We have antimicrobial resistance on the rise right now, and bioterrorism, amongst other things that are posing a serious threat today to the human race, and thereby becoming a serious public health concern. Secondly, is the rise in the non-communicable diseases, particularly cardiovascular diseases like heart disease. We have the cancers coming up, the diabetes. So these are a major public health concern, and addressing contributing factors to these non-communicable diseases such as tobacco use, unhealthy diets, and physical inactivity is crucial if we're going to circumvent this rise in these non-communicable diseases. Then we have climate change, and so climate change is increasingly being recognized as a crucial health determinant. Extreme weather events such as air pollution, food insecurity are impacting population worldwide. Particularly here in Zambia, I think the world now knows we did not have rather a good rainfall. So that is due to climate change. So there's an impact on our population. Okay, so we may have cases of malnutrition because we did not have a good rainfall. Prices of the staple food have gone up. That is one way that you see climate change affecting health of the population. Why? Because when people fail to afford nutritious food, and when we talk about nutritious food, we're talking about eating the 7 classes of food in the right quantities, right proportions. Why? Because nutrition boosts the immune system of a human being. So when you have a good immune system, you're able to fight and prevent infections, and the reverse is the case as well. Then fourthly, we have inequality. So health disparities persist based on socioeconomic status, on race, on ethnicity, on gender, and on geographic location. So addressing inequalities will require focused efforts because it's not as easy as ABCD. Okay? So collaboration with various stakeholders is going to be needed. Okay? For example, certain geographical locations are difficult to even access. You find that where in this particular location, maybe for example, the health care center or hospital or clinic is very far from where the people live. So people have to walk long distances in order to access health services. So that is a threat to the to what we're trying to achieve, which is good health for everybody. Then fifthly, it's technological advancements. So digital health technologies offer new opportunities for disease prevention, for surveillance, as well as treatment. But there's also a challenge related to data privacy and data accessibility. So how exactly are you going to make sure that the data that you generate, okay, using technological equipment is protected? Because we have patient confidentiality, but when you are looking at technological gadgets, they can be hacked. Okay, somebody would easily override your password and then access information that they're not supposed to. So how are we going to make sure that we protect, okay, the data, the privacy of people as we use these technological advancements? Okay, so to address these challenges, public health profession focus on 3 core main functions. The first one is assessment. So gathering and analyzing data to identify health needs and health problems is quite crucial. So in any given population, there need or there should be assessment, and this is done. Why? To determine the prevalence, the possibility, okay, of disease occurring. So this is important because once this is successfully done, solutions can be offered way in advance before any problem can ever invade that particular population. Secondly, policy development. So using data to inform the development of public health policies and programs is quite crucial. And last but not the least, assurance. So ensuring that essential public health services are available to every person, regardless of their social-economic status, is actually quite cardinal. Then we have areas of focus in public health, not limited to the following, but One Health is one of them, which is recognizing the interconnectedness of the human being, the animals, and environmental health. Secondly, precise public health, which is using data and technology to tailor interventions to specific populations. So when public health interventions are being done, you study the population, you look at the needs of the population and tailor your public health interventions and programs to that specific population. For example, when you want to carry out any health policy program or policy intervention regarding children, for example, okay, you need to know the number. Okay, how many children are in this geographic location? What are the problems that this group of population is facing? Then you can tailor positive yielding interventions in that location. Thirdly, mental health, which is addressing the increased burden of mental health in a particular location. Now, social determinants of health, focusing on the factors like education, income, housing, employment. Why? Because these have a direct impact on the health outcome of a human being. If in a given population, there are more people that are unemployed than those that are employed, you can agree that accessing healthcare services is going to be a challenge in this given population. And you may see a rise in a lot of health issues because people are not able to afford the health services that are being availed unto them because of their economic or income status. Then education is also one of the social determinants of health. The education level of the individual or a given population that you are dealing with is important. When you're dealing with the illiterate in terms of education, you will find that you may have a challenge in implementing certain health programs, policies, because you have to make them understand, make them adhere to the health services that you are providing. Otherwise, you are not going to be welcome. So education, income, these are some of the social determinants of health that have a bearing on the health outcomes. Then we have the health inequalities. So here we work to eliminate the disparities in the health system. Okay, now, how is Texila American University contributing to this beautiful field of public health education? So, Texila American University has emerged as a significant contributor to public health education, particularly through its emphasis on online learning and global reach. So, Texila contributions include the following things such as online delivery. So TAHU offers flexible online programs. So this makes studying easy, acquiring education easy and accessible to a wider audience, including working professions. So our students are able to work, they're able to do business, they're able to do many other things while attaining a level of education with Texila American University. And this format has allowed students to balance their lives with many other commitments, as well as fostering a positive growth in their lives education-wise. Then the other reason or the other factor that TAHU is contributing to the public health sector or public health education is global perspective. We as TAHU, we focus on global health challenges. Okay? We equip students with a broad understanding of public health issues affecting the diverse populations of the world. And we have a practicum curriculum. So it incorporates real-world case studies. We incorporate practical application into our curriculum, ensuring that students are prepared for real-world challenges. So it's not hypothetical, but real-world case studies and other practicum ways of learning are embedded in our curriculum. Then the research emphasis is also one of the ways in which we are leading. So TAHU encourages research, innovation in public health, and this fosters a culture of inquiry and critical thinking amongst our students. So our students are forced to think outside the box. They are stretched. Their skills of research are put to test. Then affordable education. TAHU offers competitive tuition fee locally and internationally, making public health education accessible to a broader demographic region. And last but not the least, TAHU employs qualified faculty members. And this is important from all walks of life, from different cultures, different races, different ethnicity. And this is good because the faculty members get to interact with one another, get to learn from each other due to the diverse in their background as well as experiences. So TAHU offers specific programs such as the Bachelor of Public Health. So this program provides foundation knowledge in public health. It prepares the graduates for various roles in different fields in the real world. Then we have our Master of Public Health, which is designed for professions seeking advanced public health expertise. So the MPH program offers specialized tracks and soon to be added to these more specific specialization such as Master of Public Health in epidemiology and the like. So by doing that, TAHU will continue to be one of the best leading world universities in terms of public health education. Then we have the Doctor of Philosophy in Public Health. So this program caters to those aspiring to be world leaders in health research as well as academics, both in the private and public sector. Then the online learning platform that TAHU offers is a platform that facilitates interactive learning, is collaborative, and gives access to a great deal of resources. That's learning resources. Now, what are some of the future trends and opportunities in public health? So the field of public health is rapidly evolving, driven by technological advancement, changing demographics, and emerging global health challenges. So this presents both opportunities and challenges for public health professions. So the future trends and opportunities will include things like precision or precise public health, which is leveraging data analytics, genomics, and artificial intelligence to tailor interventions to specific populations and achieve our global health, a world that is free of diseases. And digital health and telemedicine. This is expanding access to healthcare services through digital platforms, remote monitoring, and virtual consultations. Then One Health approach. This is addressing the interconnectedness of human, animal, and environmental health to prevent the emergence of new diseases. Then climate change and health. This is developing strategies to mitigate the health impacts of the climate, such as heat-related illnesses, infections, mental health, even malnutrition. So global health security is simply strengthening surveillance system, response capabilities, and international cooperations to prevent and to control endemics and pandemics. So, social determinants of health. This is going to address the root causes of health disparities through policies, interventions, and programs that promote equity and social justice. Then aging in the population is also important. Why? Because developing strategies to support health and well-being of the older adults, including chronic diseases, in terms of management and long-term care, is important in any given population. And mental health integration, because of the way that the world is changing. There's so many things that have come up now that were not there 20, 30 years ago. And this is indirectly and directly affecting the mental health of various people from various walks of life. Therefore, in public health, it is imperative that there be mental health integration and this should be promoted as an essential component of the overall health and well-being of an individual. Now, while these trends offer exciting opportunities to improve the global population health, they also present challenges. What type of challenges do these present? Data privacy and security, like I earlier stipulated. Protecting sensitive health information while utilizing data for public health purposes is quite cardinal because, gadgets, computers can be hacked, the system can be hacked, and that can be dangerous. Digital divide, which is ensuring equitable access to digital health technologies for all populations. This is also a challenge. How do you actually make sure that digital services are equally distributed, equally accessible, equally safe for all populations in the world? The third challenge is the workforce development. Building a skilled public health workforce with the competence to address emerging challenges is not an easy thing. Then funding and resource allocation. Here, you secure adequate funding for public health programs and prioritize investment in the prevention. So again, generating resources is not an easy thing. People need to come together. People need to collaborate. People must be willing to invest in the field of public health. They must share in the vision of public health, population prevention. Then that is no longer going to be a challenge. So, in conclusion, public health in the 21st century demands a comprehensive approach that is going to consider the complex interplay of factors that influence population health. It requires collaboration across the sectors, innovation solution, and a strong commitment to social justice. And by embracing these trends and addressing the associated challenges, public health professions can play a crucial role in shaping a healthier future for all people on the globe. Ladies and gentlemen, thank you very much for your time. I'll invite questions at this moment.
So attendees, you can, do you have any other doubts you can ask? Any other questions from the attendee side? You can ask the questions. You can post your questions in the chat box or else you can raise your hands so that I will allow you to talk. Yes, Mr. Christopher, you can unmute yourself and talk.
Okay, thank you so much. I'm called Laho Christopher. I'm also one of the public health officer, and I really appreciate the presentation. It's so very precise. And we are looking at articulating all this or bringing it together like to strengthen the holistic approach. So is there any strategy that Texila will think of mainstreaming all this programming to ensure a holistic approach? For example, integrating the mental health. Are we going to strengthen? We need to be so more specific, like what are the mental health issues which are common in the world, and we need to put them together. Then secondly, we need to come up with a guideline to ensure like developing a framework where we see how these issues can be articulated together. So is there a strategy like developing a framework where all these issues to ensure a holistic approach is achieved that Texila is trying to strategize on? Thank you so much. Back to you.
Okay, thank you very much for your question, and thank you very much for your kind words over the presentation. So I think I would answer your question by saying, being able to effectively carry out intervention has its own challenges. So yes, Texila is on the right path, trying to, circumvent many of these public health issues. But things like resource allocation come in because it's not only, the public health sector that Texila influences, but be rest assured that policies are being made, interventions are being discussed. Like I said in my presentation, one of the ways that Texila is aiming to improve and continue to make impact in public health is by bringing more programs that are specifically tailored for certain issues. For example, a master's in public health with epidemiology or in epidemiology, meaning it is not like the general public health, but will be training specialists specifically in epidemiology, which is the studying of infectious diseases and how they can be prevented. So that is one of the ways that I think Texila will greatly contribute and just have positive impact in this area. With regards to the mental health area that you touched, I agree with your sentiment and your contribution. At the end of the day, it is not one man's show, but it is everybody collaborating. So everybody has to come on board. Everybody needs to give their input in different ways because everyone's contribution is important. Thank you so much.
The polls are launched. Attendees are requested to attend the polls. So any other questions from the attendee side, you can post your questions in the Q&A, or else you can post your questions in the chat box.
Okay, so I can see a question there. It's saying, what is your level of collaboration with French-speaking countries in public health? Okay, so I believe that question is from the angle of offering the public health, both BPH, MPH, and PhD to French-speaking nationals. Well, Texila accepts everyone. I'm sure you know that we have a diverse range of students from all walks of life. Okay, but particularly Texila American University Zambia, we offer our education in English. Yes, so in case that is what we are asking, Tahu Zambia teaches in English, strictly English. Yeah. Is there any plan to start offering PhD in epidemiology in future? Yes, Crispin. Actually, it's closer than you think. And not only in epidemiology, but other fields as well. This will be communicated as soon as the policies are accepted, the appropriate registrations with the local authorities as well as international authorities are granted. So that is in the pipeline. Thank you, Crispin, for your question. Alan is asking, how does public health differ from every other health profession? Okay, like its unique impact. Okay, thank you, Alade, for that question. Well, public health deals with global health, disease prevention in general. So there are various specifications of public health, but the main focus or the main goal of public health is to prevent disease in the population, entire population. So it focuses on the whole population rather than an individual. Whereas, for example, medicine, if you are starting to be a medical doctor, your services are more tailored on an individual level rather than the entire nation at large. I don't know if you get the difference, but yes, that's the difference. So public health is more population oriented than individualistic. Okay, thank you.
Yeah, thank you. Thank you
Sure.
for joining us. A big virtual thank you to each and everyone for making our webinar a grand success. Thank you so much, attendees, and thank you so much, speaker, for the session.
Thank you so much.
Yeah, thank you.